Yeah, you're live.
Not sure if I'm live now.
You are live.
Can you see?
Let's have a look. Oh, hopefully by the time we do this on Monday, I tell you it's going to, yeah, you're now live.
Excellent.
Yeah. I'll sign off, Wendy.
Okay, all right.
People can hear you.
Hello, everyone, if there's anyone out there. My name's Wendy Randall. I'm the consultant midwife, or one of the consultant midwives at the John Radcliffe Hospital. I'm sorry, I'm just getting used to the tech, so it took me a little bit longer to get on today. Hopefully next week will be easier. Does anybody have any questions for me? No, I'm not even sure there's anybody out there.
No, you've got 16 people viewing it. 17 people viewing it. There you
go. So I've got a message from Laura saying, I'm concerned about being a first-time parent with no family around me, about my husband having to leave so soon after the birth. You're due in May. So Laura, we are really sorry about the restrictions that we have had to put on partners having to leave after the birth of the baby. Obviously, we're not planning to rush your partner out as soon as the baby's born. But what we can't do is we have to reduce numbers of people coming through the hospital to protect yourselves and to protect our staff. So we can't have extra people going up onto the wards. So it's at the time that you're transferred from your birth environment, whether it be the room on the Spires, the room at Wallingford, at the Horton, in the John Radcliffe, but we have to minimise the amount of people that are left in the unit. We have got lots of different staff groups available so that you will get as much support as you can while you are staying in hospital. So like I said, we're terribly sorry about all of this, but we are just trying to provide as safe a service as possible and trying to reduce the spread of this awful virus. Sarah, you've posted that you've had your 12-week scan, so new to pregnancy, congratulations. You're finding your stomach itchy, and yes, it's perfectly safe to use many lotions and potions on your stomach. You can, any sort of body butter is quite good because if you buy body butter for especially dry skin, it's very good, and just pop it on your tummy morning and night. There might be other people out there who have other suggestions, but that should be fine. And in terms of laying on your back, not lying on your back to sleep, we just encourage you to get used to lying on your side. As the baby grows and gets bigger, the baby will tell you that it's time for you to start lying on your side because it will kick and wriggle until you do it. But there are some people that start off lying on their side and wake up on their backs. Please don't worry about that. Your baby will tell you when it wants you to lie onto your side. But start practicing now from early on. But it is important that you get your sleep. Do we have any other questions? It was very nice of you, Katie, to say hello to me. Hello to you too. So I know this has been a very unusual time for all of us, and I hope that you're managing, some people are staying in their house completely and never going out. It is important for you to still go out and have some exercise once a day, but obviously making sure that you are at least 2 meters away from anybody else, and that, try not to touch gates and things like that if you're going through those. Use your jacket or scarf or something if you have to open them. But it is still important for you to get your exercise, and it's good for your mental health as well. When the weather's nice, to get out there and have a walk. I can't see the questions. Do I have to scroll down? Oh, there you go. I actually have to scroll. Like I said, first time for me. So Lucy, you've asked, are home births being cancelled in Oxfordshire? No, Lucy, the home births aren't being cancelled in Oxfordshire. We're still really pleased that we can offer home births, our freestanding midwifery-led unit and our alongside midwifery-led unit. You know, the thing that will change is that we're getting a lot of people requesting home births, and obviously we only have a set number of community midwives on call in the night. So I know for last night, every single one of our community midwives were out at home births. So busy night for home births last night. Stephanie, you've asked if the Spires births are being affected. No, we are staffed on the Spires and continuing as normal. So we try to move our staff around so that we can still offer all birth choices. Please be reassured that we're going to try to make sure that we can still help you to achieve your birth choice during this time. Jess, you've asked, will birth partners be able to stay with mothers post-birth in private rooms, such as postnatal rooms in the Spires? I'm afraid even though those rooms are single and they're en suite, we're still encouraging partners to go home because it's just about the reduced flow through the hospital. You know, our midwives have to be in contact with many different people. So although you've met the midwife who's at the birth, when the new midwife comes on duty, she won't have met your partner. So being exposed again there is another person that the midwife's exposed to. We have to just keep it down to a minimum so that we can keep our midwives in post and our housekeepers and our domestics and all the other people. So it is about trying to reduce the numbers that are in hospital for a length of time and the exposure to other people. Leanne, I think you said you did gestational diabetes and you're just wondering if you have to stay in longer after birth because of this. You're worried about being at home. Leanne, we just do some, we just check the baby's blood sugar, depending on how we're managing your gestational diabetes. You know, sometimes it's just for a short period of time and sometimes it's overnight. Please be reassured, we understand that you're anxiety. A lot of women are anxious about being alone at this time, and that we will make sure that we try our best. We'll not be as good as your partner, but we'll do everything we can to support you. Lydia, you had your little girl at the end of September, and you wanted to know about birth afterthoughts and whether it's still an option at the moment. Actually, Lydia, I'm not sure what's happening with our birth afterthoughts session at the moment. If you call the midwife, she will call you back and let you know. But I will get an answer to that question and post it up for you. You know, we may be able to do it over the telephone, like we're doing some of our antenatal consultations already. So we'll try and get you an answer for that afterwards. Lorna, a question for tomorrow with my first. You had to go back to theatre. Okay, so you're talking about if you've had your baby and you go and your partner then goes home and you have to go back into theatre for more care, who's going to help with your baby. You know, those are very, very rare situations to come across, and we will try to ensure that you know, we will ultimately look after your baby, but if you need some extra support, then that's something we may have to consider calling your partner back in. But please be reassured, we're used to looking after babies, and we will make sure that your baby is okay for the period of time that you're not there. And quite often now babies are going back into theatres with mum if the midwife's going back in there too, so that you will all be together. Paula, your husband has a health condition and you're anxious about him being exposed to the virus during labour because you're self-isolating. Paula, we are talking to people about that. It's a very difficult decision for you and your partner to make. You know, we're obviously advising people to reduce their contact. And it may be that coming into the hospital with you isn't the best thing for your partner to do. and that perhaps having a different birth partner would be good. We're still, you know, some people are mentioning about using phones to FaceTime during the birth, and that may be something that would be more suitable for your husband. Although he wouldn't be directly there, he could be part of it via social media. But it's a decision that I'm afraid you'll have to make in yourself. All I can do to reassure you is that we are reducing the amount of people that come in through our hospital, to reduce the contact with people, to reduce the spread of infection. So we are very much trying to help people like your husband, but it will come down to the day how he feels about coming into hospital, or whether it would be safer for him to be at home and for you to have somebody different to support you. I am really sorry. These are very difficult conversations for many people to be having together. Katie, you've said that your baby is breech. You have a 36-week scan. Your 36-week scan, your 36-week appointment have been cancelled. What happens in labour if you go into labour before this? Katie, at 34 weeks gestation, it's quite common for babies still to be breech, and especially when you're on your third baby, it can take up to sort of 38 weeks before they start to adopt the position that they're going to be in for the birth. I would go to your planned place of birth as you're intending to do, and your midwife will examine you. And if she is happy that baby is head down, then you can continue with your birth there. When the midwife pops her hands on you, if she feels that that baby isn't in a head down position, she would obviously transfer you up to the John Radcliffe delivery suite if it's Wallingford you're choosing to go to. When your midwife sees you at 38 weeks, if you haven't gone into labour by then, if she feels that baby might still be breeched, then she will refer you to our breech clinic, and we can help to support you there. I hope that answers your questions. Laura, so you're thinking about trying for a baby this year. That's good, that's exciting. And you have anxiety over birth generally, which is why you haven't tried earlier. Laura, you know, all I can say recommend is perhaps there are lots of social media groups out there that might be able to help. There's a very successful positive birth movement in Oxford. You might want to talk to them about it. You know, there's various books and things out there that you can read. I'm trying to think what the book is, but I know maybe somebody can blip in. It's going out my head because I'm watching these questions now popping up. I'm Marie Gaskin, but you know, I think starting to read around books and see the positivity of birth might help you. Claire, you said that you understand at home births that you have to keep the children out of the room, but how do you do it? If not, can somebody collect the baby? Yes, if you're happy for your baby to be collected and taken by somebody else, then absolutely. What we're just trying to do again is reduce the contact. You have to understand that our community midwives are still seeing quite a lot of different people. And whilst they wouldn't attend you if they had symptoms, they may be attending you when the symptoms haven't come yet. So what we don't want to do is for us to expose you to the potential for infection, or, you know, if you are asymptomatic, to expose them to infection, because we don't want to then be spreaders and taking it round the rest. So there's a little bit more to think about in terms of home birth when you're planning it this time. But ultimately somebody has to be responsible for your child. So whether you get somebody to come and collect them and take them away, or else it would be your partner that has to do that. And then obviously the midwife would be there to support you at the home birth. Naomi, you're having your 5th baby. So you're having your 5th baby and you're ready for her to come because you're fed up being at home and nesting. I wish there wasn't social distancing and I could encourage you to come and nest at mine, because mine definitely needs a bit of sorting out and tidying. I'm really sorry that you're stuck at home, and that must be very difficult with 4 children. But, you know, crucially, I do think if you can go out and get that walk once a day and see if you can hurry things along, that would be great. Maria, you've asked what the update is on birth partner, when you're allowed and what, and afterwards. All I can say, Maria, is that we're allowing 1 birth partner present at the birth. So if you want to have a look at our website, we're trying to update that. So if you look at Oxford University Hospital's website and their maternity page, you will see that we're updating that regularly. So it does tell you what the birth partner position is, but generally it's just a partner there for the time that you are in labour or having your planned caesarean section, and then afterwards your partner would go home. Unless you're ready to leave the hospital with them, in which case you can all go home together. So Esther, you've said again about partners, partners allowed for birth only. Can you confirm that partners are in fact allowed to be with you for the duration of labour? Yes, Esther, when you're on the delivery suite or the Spires, when you're in Wallingford or you know, our midwifery-led units, yes, then your partners can be with you. If you are in early labour with and are admitted, say, to our antenatal ward because you haven't wanted to go home, then unfortunately your partner couldn't be with you then. If I can just hold on for a minute, I just have a message I need to get my daughter to answer for me. Sorry, you don't get peace to have an hour to yourself. It is something about work, I promise. So I hope that makes sense for your question, Esther. Claire, you said you were hoping to have a water birth in Wantage. Will this be possible? Okay, so I think if you have any questions about your health, Claire, that you've mentioned, then you can contact the maternity assessment unit or your midwives for more advice. Claire, you've mentioned that you would like to birth in Wantage midwifery-led unit. You're only 33 weeks pregnant, and so things may change at the time, but I'm very sad to say that as of today, we've had to close Wantage midwifery-led unit for births. It's only for births, and we will be looking at it on a day-to-day basis. But unfortunately, we've had a lot of issues with staffing of Wantage, and our midwives are really struggling to be able to still provide the antenatal and postnatal care, and are really struggling with the births as well. So at present, we will be diverting women who are planning to birth at Wantage. You still have the option of using Wallingford, so you've still got a freestanding midwifery-led unit, or there's home birth, or there's the Spires, or there's delivery suite. So you've still got 4 options. It's just that we're very sad at this period of time to say that from today, we won't be able to offer births at Wantage. Like I said, this is only 33 weeks, and if our staffing levels improve, hopefully we'll be able to reopen Wantage to births, but we are just going to have to look at it on a day-to-day basis. Ian, hello. I've had to use partner's account. I'm due 25-week GP appointment. Do you still think I can book this? Rowena, there are some changes happening to the antenatal pathway, which again we're going to post on our website to make sure that everybody has the most up-to-date information. But I think the 25-week appointment is not going to be happening the way it was before. So please look for that. But we are contacting everybody We have midwives who are unable to work in clinical practice due to either being pregnant themselves or having health conditions, who are doing phone calls to people to keep them up to date with what's happening with the appointment structure. So we've had to minimise what we're doing and take away some of the face-to-face contact, but I can promise you that we will be still making sure that you and the baby are safe throughout the pregnancy. Okay, so Kate, you said that you're due in May. Is it possible for the midwife to come out to meet me at the entrance, as my husband would have to drop me off outside? We already have 2 children, so he couldn't come in. My previous labours have been extremely quick without much gap between contractions, so I don't think I'd be able to walk on my own. Kate, if you're planning to come to the John Radcliffe to have your baby, if you phone the maternity assessment unit when you arrive, then somebody will come out and help you into the hospital. So Laura, partner and I were going to start trying for baby later in the year. We've probably had one already if I wasn't so anxious over the birth. You have said that you want to elect for a caesarean. Laura, again, this is one of the choices that we're struggling with at the minute, especially due to COVID times, but you're not pregnant at this time. But I think it is very important for you to be able to speak to somebody to talk about your thoughts and what you're doing in terms of planning for the birth of your baby, because not every hospital does offer the choice for women to choose to have a caesarean section. Certainly in Oxford, we do them if there's a medical indication for them in general terms, and if women still want to choose it and there's no medical indication for it, we normally have a pathway in Gloucester where we can refer women to, but at present Gloucester are deciding not to support that pathway due to the COVID infection. Excuse me just a section. So somebody's raised the question of, will my partner be able to come with me to a scan in a month? I think the anticipation is that the peak of the effects of this virus are going to be within the next few weeks. And so I imagine in a month's time, we're still going to be in the same situation in terms of partners attending the hospital. So at present, I'm afraid your partner won't be able to come to the scan with you. Unfortunately, our scan department have taken advice from their national professional body, who have said that they don't want people to use films to video during the scans. So we're terribly sorry about that. We appreciate that that is not great because scans are such an exciting time for all of you. But you know, we're trying to do everything we can to make this as positive an experience for you. You know, it is in a month's time, and who knows what will happen then. But please do continue to look on our website for more up-to-date information. Nave, you've asked if the hospital plans to send partners home after birth. It's the postnatal ward staff for this. We absolutely are. We're trying to make sure that we've got lots of support up there. We're lucky enough to have midwives, maternity support workers. We've got midwifery students who've decided to stay to help us, which is great. We've got registered nurses who are helping us. Our breastfeeding team are actually working clinically on the wards now as well. So we've got a whole team of people there to support you. And what we're finding is, because we've streamlined our discharge pathway and we're managing to get people home quicker, we're able to concentrate on the people that really do need the most help. So we're trying everything we can to make the postnatal stay a much more positive experience. So Kelly, with my first labour, I struggled moving around. expecting again in August and would love to have a more active birth. Is there anything I can do to help this time? Kelly, I think, you know, having an active birth is great. We were fortunate enough before all of the virus hype picked up to get wireless and waterproof monitors for every room in our delivery suite, which means if you need to come to delivery suite to have your baby, women are being able, it's much easier for women to be upright and mobile, and we have balls and bean bags and mats to help with that. If women are in our midwifery-led units, again, we have all sorts of birthing aids to be able to help you, and there are birthing pools available too. So I think, you know, making sure that you can gently exercise every day is great. And whilst I know you can't go outside for long in terms of walking, there's some fantastic classes being held on social media. I know various people that are running Pilates classes and yoga classes, and I've got an online class thing that I'm doing, and they have specific exercises if you're pregnant. So everybody's trying everything they can to help people have a more positive experience during these times. But yes, I think thinking about, I don't know any of your history, but whether a midwifery-led unit or home birth is a good option for you, then that will be worth thinking about too. Chiara, you said you're due now. Will me and my partner have to wear masks and gloves during labour? Chiara, you only have to wear masks and gloves, and well, you wouldn't need to wear an apron. Your partner, if you or your partner, anyone in your household is symptomatic of COVID, you will find that the midwives are having to wear masks and goggles and aprons and gloves throughout your labour, which can look a little bit daunting. I posted some pictures of our personal protective equipment last week via this Facebook page, and even that has changed a little bit more in terms of what you'll see us wearing. But you will only have to wear masks and gloves if you have symptoms of COVID. And please, if you're phoning up your birth environment, please note you will be asked questions about whether to do some screening for presence of COVID. So Sarah, you're having a caesarean section on the 14th of April, and how long will you be in hospital? Bless you, been told you'll go home the same day. I promise we're not going to make you go home the same day. You won't feel up to going home then. We plan to get you home the following day if everything has gone well. So you come in for your planned caesarean section. Generally, it will be done during the day. And then our expectation is that hopefully we'll be able to have you home the following day. And we'll make sure that you have enough time so that your partner can come back and get you. Jess, you've asked if discharge times post-birth are being sped up to reduce the hospital environment. Yes, absolutely. We've got all sorts of pathways in place to enable that to happen. It could be a blessing because it's one of the things that we've been criticised for in the past, that we've been quite slow to do. So hopefully this is something positive that's coming out of it, is that we'll try to get you home as soon as we can. Laura, is it normal to have period-like cramps, intense backache and Braxton Hicks from 33 weeks? Laura, we say that it can be normal to have Braxton Hicks, and backache is something that comes with being pregnant. If you take some paracetamol and your backache doesn't ease, not your backache, if you're having pain, period-like cramps, and it doesn't ease, then we'd advise you to take paracetamol. If it doesn't ease, then if you call the maternity assessment unit, they can give you some more advice. I think, the Braxton Hicks can be quite uncomfortable at times, especially as it goes very tight. So Sophia, you were 36-week pregnant and you were told that you can use a birthing pool in the spires for pain relief, but you can't give birth in the pool. What's the actual reason for this? Sophia, I'm not sure. because obviously I don't have your records in front of me. I'm not sure why you may not be able to give birth in the pool. We have had to make some changes to the water birth guideline, but really it only applies to people who are, again, symptomatic of COVID. So I'm not sure, perhaps if you can contact us, we can have a look at that again for you. Lisa. Lisa, you've asked about support for breastfeeding in hospital. All our midwives are trained and maternity support workers are trained to baby-friendly standard to be able to help you with breastfeeding. We're not going to discharge you home if you're not happy with how you're feeding your baby. That is very important to do. So we will make sure that you have had a couple of good feeds and are feeling confident before you go home from the hospital. Chiara, you said you didn't like wearing the mask. I think that's to do with you wearing the mask in labour. Chiara, the only time you're going to have to wear the mask in labour is if, again, if you have COVID-like symptoms. And we are looking at that because for women that are using Entonox, it will be very difficult for them to use a mask. So we are adapting things as much as we can. So Jo, you're asking, is the plan to keep the midwifery-led units open at the moment? And you're hoping for home birth or Wallingford? Absolutely, we are. Our mission is to keep the midwifery-led units open. As I've sadly had to say, Wantage is closing in the short term due to staffing shortages for that team. But Wallingford is still open for all the women that live in the south. The women who are more central Oxford can travel out to the midwifery-led units, but there is the Spire still open for them. And at present, we still have the Cotswold Maternity Unit in Banbury in the north. So we've still got, 4 midwifery-led units available, and we're still running a functional home birth service. Keris, you've asked, are 36-week scans being cancelled? Basically what's happening, Keris, is that we're looking at all 36-week scans and the reasons for those 36-week scans. If it's just because it was routine and part of our pathway, then those scans are being cancelled. But if they are for a clinical reason, and yours would be for a clinical reason, then your scan will still continue. So Stephanie, you were told by your community midwife you shouldn't be out at all from when you get to 37 weeks, which is now even for a walk. Stephanie, I think if we try to lock people away in their homes, it is not good for them and it's not good for their mental health. What we don't want to do is for people to be going to supermarkets or coming within 2-metre distance of people. So if you have the capacity to go out for a walk where you're sure that you won't come across other people, that you can't pass at a safe distance, then don't go out. The way that the virus is spread is respiratory, and the droplets can travel about 1 metre. Obviously, if you cough or sneeze, those can happen. Those droplets will go much further. So it's why it's so important for people to use a tissue if they cough or sneeze, dispose of it and wash their hands thoroughly. It can also be dropped by contact with surfaces. So we're saying if people are out and about, if you have to go through gates, don't touch the gate. Excuse me. Use a tissue or a glove or ask somebody else to open the gate for you. But it is about if you touch anything, you must make sure that you wash your hands thoroughly. The virus is caused through mucous membrane. So if you touch something and then you touch your mouth or your face or your eyes, that's when you're likely to pass on the virus, get contact from the virus. Danielle, you've asked about usual checks being done after the birth, like hearing tests. Again, I think this is something I'll have to follow up on because I'm sorry, that's not one that's at the top of my mind with where we're going. I know that we're trying to keep doing the vital things that we have to do, but I will post again after our discussion today about birth afterthoughts and the hearing tests. So Julia, you're worried about virus exposure attending antenatal appointments and scans. What you can do to reduce the virus, and does this have an impact on where you give birth to your baby? So Julia, we are doing everything that we can to reduce the risk of you catching the virus. I just explained how the virus is spread. So when you attend for your antenatal checks, you will be encouraged to wash your hands before you come in. You will see that the midwife will be wearing a mask and gloves, and she will, and all the surfaces and things that are in the appointment where you have to go will have been wiped down between people to make sure that that any bugs that have been left behind when things would have been touched have been killed. We use alcohol-based wipes to wipe them down to make sure that we're reducing contact and spread for you. I think we've done everything we can to keep your appointments to a minimum, and the appointments that the midwife is encouraging you to attend, I think that would be really good to attend because they are there for a reason. So we're taking all these steps that we can to keep you as safe as possible. And so the appointments and tests that you are being told to go to are actually important for your pregnancy. So I think that's important, making sure we have a well mum and baby for the scan. Just got a silly advert up. I don't want that at all. Sorry. And you've mentioned about Wantage Hospital. And again, I just reiterate from earlier, very sadly, we've had to stop births at Wantage Hospital in the short term due to staffing problems. But there is Wallingford available for you, and there is still the home birth option. Yvonne, you've asked, will birth partners be allowed into recovery? Again, in our observation area, normally visiting time is open, but we've had to reduce that for about an hour after the birth. So we're not going to chase partners home. But again, it is being aware that these are 4-bedded bays in our observation area, and it's really important that we minimise the risk of contact with other people. Again, all I can do is reassure you that we will do everything we can to ensure that we are helping with feeding, with the skin-to-skin contact, to make a difference. Hi, Sophia, you've said they're generally being cancelled. Okay, so you were just replying to somebody else's comment. Thank you. Christy, you're 33 weeks pregnant with your second baby and you were induced at 42 weeks. If induced again, will we be allowed to walk around outside the hospital in between monitoring by the midwife? Christy, at present, we are changing our induction of labour pathway. We've been doing it in conjunction with Maternity Voices to make sure that we're making changes that will be advantageous to women. So I think it's watch this space in terms of induction. We've got time. More of our new pathway will be shared with you hopefully in the next week or two when it gets close to that going live. Bryony, 35 weeks pregnant with twins. And again, I think this is a common question. People are quite worried about how they're going to cope with their partners going home and how they're going to cope with whether it's one baby or two babies. Please be reassured that we have got lots of people coming to help us, and we will, help to support you with feeding. We know how important it is, and we appreciate that you're not going to have your partners with you. So we will do everything we can to make sure that you get the help that you need to feed your baby. Thank you, Debbie. Rachel, is the birth thoughts discussion with a midwife still available? Again, I'm going to post that after today because I'm not quite sure what's happening with the service, the birth afterthought service, but I will make sure that that question is answered and put up on Maternity Voices for you. Okay, and again, Shez, you're due to have your baby at the Spires. That's fantastic, and having a pool birth there. Shez, in your circumstances, we'd advise you to come out of the pool to birth your baby, so using it for the labour, but come out so that the midwife can have a much more hands-on approach to try and prevent you having a tear again like you had last time. And if you did have a tear like you had last time, your partner will still be with you until will still be with you down if you had to go to theatre to have it repaired again, and then we'll leave you after then. Claire, that is a lovely comment about Carolina Edwards, your midwife. I couldn't agree with you more. All our midwives, I think, are fantastic, but Carolina is a very kind and lovely person. Stacey, you are on pathway D for your scans, and your scans will continue to happen as we have planned them because we have assessed them as being important to do. So the only scans that we will be cancelling are ones that we feel are not essential to do at the time. So Sophia, it says, it sounds like the issue with the birthing pool is not specific to me, but in general, well, at the moment you can use the pool when in labour. Okay, so Sophia, the world of how we're responding to COVID changes all the time. And initially, lots of organisations were cancelling water births because COVID is known to be present in the faeces. And quite often during birth, women will open their bowels and pass faeces. And what we didn't want to do was put the woman and the midwife, because we put our hands in the water, at risk of faeces. So initially we were told that women had to lift their abdomens out of the water for us to listen to baby's heart rate, that they would have to leave the pool for vaginal examinations, and that they would have to leave the pool for the birth of their baby. When I actually looked into the evidence behind this, because I think it's really important that we are sensible and not too reactionary, when you looked at the studies that came out of China, because that's where a lot of our information is coming from, the virus was only present in something like 29% of the patients in their faeces. So it's not present in all of the faeces, so it's not as virulent as they thought it was. And they also said that we talked to virologists about what that actually meant. And they said, well, if you touched faeces, which we wouldn't do without gloves on anyway, if you then touched the faeces and then touched your mucous membranes, that's how you would pass on the virus. Well, none of us are going to touch faeces and then touch our mucous membranes, our eyes and nose and mouth. So anytime we've had our hands in the water for a pool birth, we need to take them out of the water and wash them thoroughly. So with good hand hygiene, there is not a risk of us having contamination. So one of the things I've done is rewritten the guidance and put the evidence in there, and I've circulated it out to all of the community midwives, and I put it up so that all the hospital midwives can see it as well, so that they can be reassured. Now I have to say some midwives are really anxious, as a lot of you are in community as well, about contracting virus. And I think if the midwife still feels more comfortable in asking you to lift your bum out of the water for her to listen to the heart rate, then I hope you will respect that, because I'm concerned about her risk of infection. But from your perspective, you should be reassured that because your midwife is washing her hands thoroughly, that you're being looked after and the risk is minimal. Kat, I'm hoping that you got the answer to this question. You've asked, will you be able to watch this later? I have no idea. I have no idea how this tech works, but hopefully somebody from the Maternity Voices Partnership will be able to answer that for you. Dominic, you were saying that you're pregnant and your husband is still working due to being a key worker. Is it safe for him to work right up until I go into labour, or should he be finishing work earlier? Dominique, absolutely. You know, your husband is a key worker. He will be following all the measures that we are, and he will be using his personal protective equipment in the same way. So yes, it is still okay for him to work right up in time until the time of your labour. Thank you very much, the Daisy Foundation. Oh, thank you all. You're being very kind. I think I'm going to have to finish for today, and I think my questions might have run out anyway. I'm sorry that I was a bit not very tech savvy to begin with. I will be back Monday next week, Monday, Wednesday and Friday, and hope that you can help do what you can to keep people feeling, you know, safe. You know, you are our key priority. We want a safe mum and baby. And whilst we know that these are extraordinary times and it's difficult for you and your families, we have to try and keep you guys as safe as possible. We have to keep our staff as safe as possible. So thank you very much. Thank you for all your support. And I hope you all have a lovely sunny weekend.